Hello, class. Today we're going to be presenting on the opioid crisis and specifically the prevention and treatment strategies. Healthcare problem and background. Opioids have been around for thousands of years, but in the 1800s is when they were first isolated. They access what we call opioid receptors in the body, which block the pain receptors and aids in pain management. Opioid use disorder can occur when individuals abuse a drug from its intended use, either by taking it too often or in higher doses. They rely on the drug when it is also not needed. Opioid use has been increasing and is leading to more and more deaths due to misuse. If you look at the chart on the right-hand side, you'll see there's been 3 waves of opioid overdose deaths over the last 25 years. In the 90s, prescription opioids, some common names, Percocets, Vicodin, and Dilaudid, were really popular. And then in 2010, heroin. And then 2013, synthetic opioids, fentanyl, methadone, and tramadol have kind of taken over. And later on in some of the slides, we'll see some of the organizations and some of their policies and stuff that they're trying to do to combat the new synthetic opioids. Below are some agencies and organizations that are being put in place to help combat opioid misuse and deaths. The two I would really like to touch on is the NIDA, National Institute of Drug Abuse, and the SAMHSA, Substance Abuse Mental Health Services. NIDA, their main mission is to advance science on drug use and addiction to improve public health. So they kind of take the more science approach to it. And then SAMHSA, they take more of the mental health part and they offer services to help people get over their addiction. All of these agencies and organizations combined, they come out with good practices. I know Narcan was a result of some of these agencies together. I know personally as an EMT, there's been many times where a patient that needs Narcan, they wouldn't have made it if it weren't for Narcan. And then a lot of rehab services to try and tackle the mental health part to help those get over their addiction. It's important that we keep these agencies and organizations funded and keeping them going. Again, highlighting the Substance Abuse and Mental Health Services Administration. This organization helps with preventing and providing treatment for those misusing substances or with mental illness and aids in the recovery by giving access to information, resources, and healthy practices. The leader chosen is Dr. Rachel Levine from SAMHSA, and as the Assistant Secretary for Health, her main mission was to address the opioid crisis. She has focused her leadership on reducing opioid addiction, advancing recovery efforts, and improving access to treatment services all across the country. Leadership analysis on Dr. Levine and how she shows transformational leadership. Transformational leadership focuses on inspiring and motivating followers to achieve a collective vision and initiate significant organizational change. Dr. Levine exhibits transformational leadership by pushing for a shift in how opioid addiction is addressed, advocating for policy changes that focus on rehab rather than punishment. Some examples that Dr. Levine shows is that she has been instrumental in advocating for comprehensive addiction treatment, which includes rehab, prevention, and education programs. She has worked tirelessly to ensure that resources are allocated to communities most impacted by the opioid crisis. Some concepts and connections. Dr. Levine leadership aligns with the core principles of transformational leadership by emphasizing long-term change and promoting sustainable solutions to the opioid crisis. Her ability to inspire change across various sectors highlights the transformational impact of her leadership. Moving forward with leadership analysis, we'll explore how Dr. Levine shows emotional intelligence, Emotional intelligence refers to the ability to manage one's own emotion and understand the emotions of others. Dr. Levine demonstrates high emotional intelligence through her compassionate approach to the opioid epidemic, recognizing the emotional and psychological struggles that accompany addiction. Some examples are that Dr. Levine uses her platform to reduce stigma around addiction and encourages individuals to seek help without fear of judgment. By openly addressing the emotional impact of addiction, she fosters an environment of empathy and support, concepts, and connection. Dr. Levine's emotional intelligence is key to her leadership effectiveness. Her empathy helps build trust and strengthens relationships with those affected by addiction, ultimately creating a more supportive environment for addressing public health crises. Finally, in the leadership analysis, we'll go over collaborative leadership. Collaborative leadership emphasizes teamwork and cooperation among different groups to solve complex issues. Dr. Levine fosters collaboration by bringing together various stakeholders, including public health agencies, advocacy groups, and state governments to address the opioid crisis collectively. Some examples are under Dr. Levine's leadership, SAMHSA has worked closely with state governments and other public health entities to develop and implement comprehensive prevention and treatment programs. Her collaborative approach ensures that all parties involved are working toward a unified goal. Concepts and connection. Dr. Levine uses use of collaborative leadership principles underscores the importance of teamwork and partnerships in effectively tackling a public health challenge as complex as the opioid crisis. Her leadership encourages the pooling of resources and expertise to address the issue from multiple angles.
Negative traits and recommendations for improvement include overdependence on policy framework. So the trait is Dr. Levine's reliance on formal policy framework. While it is essential for national coordination, it can sometimes slow down the implementation process and result in delays in critical interventions. An example of this is some of the substance abuse and mental health service administrations initiative have faced delays due to the time it takes to gain approval for policy changes and allocate resources, at which this can slow down intervention efforts in areas facing acute opioid crisis. The recommendation for improvement include to mitigate this. To mitigate this, Dr. Levine could streamline decision-making processes by empowering local leaders to act quickly in urgent situations. Thus, this reduces bureaucracy. Dr. Levine could facilitate faster responses to evolving public health needs. Another negative trait includes limited focus on grassroots engagement. While Dr. Levine has excelled at policy level interventions, a greater emphasis on grassroots engagement could help ensure that national strategies resonate with local needs. An example of this is that in some communities there may be a disconnect between national programs and the local realities they aim to address. Strengthening engagement with local stakeholders and incorporating their input into policy design and implementation could improve program relevance and effectiveness. The recommendation for improvement is that Dr. Levine could work to increase local involvement in the decision making process. And by adopting a more inclusive approach and listening to the needs of communities directly impacted by opioid misuse, Dr. Levine could ensure that the substance abuse and mental health service administration's policy are more tailored to local contexts and more effective on the ground. In conclusion, Dr. Rachel Levine has shown significant leadership in managing the opioid crisis, demonstrating a deep commitment to transformational leadership, emotional intelligence, and collaborative leadership. However, addressing the challenges related to policy implementation speed and grassroots engagement could further enhance her effectiveness. By improving decision making flexibility and fostering greater local involvement, Dr. Levine can continue to build on her leadership legacy in addressing the opioid epidemic.